Good afternoon.
Okay, Minister, why are you leaving this up to individual hospitals? Isn't it better to have one sort of blanket policy as opposed to a patchwork across the province?
No, we decided that this is the right decision for right now here in Ontario, while individual hospitals can make their own determination. We had to really do a risk assessment, taking a look at the answers that we received from the many groups that the Premier sent the letter to, as well as what's going on the ground in other jurisdictions. And we know that in British Columbia, for example, they've had to cancel some of their scheduled surgeries because they've got about 3,300 workers that are out on leave now and are being requested to have vaccinations. And Quebec has just announced that they are taking another look at their original mandatory vaccination policy. So we took a look at that and the concern that we had that we would lose some of our precious health human resources compared to a relatively small number of outbreaks. And that's why the determination was made not to proceed with a mandatory policy at this time, although we're continuing to watch the numbers every day, and we'll see what happens as we go further into the winter.
Any particular areas in the province you were concerned about? Because if you look at UHN, for example, they've had a lot of success with their mandatory vaccine policy.
We heard from different groups, depending on where they are in the province of Ontario. Some places are really struggling more with health human resources than other areas. But that's something, one of the primary concerns that we needed to take into consideration, because we don't want to have to cancel surgeries. In Ontario, we've been very fortunate that we've been able to keep those surgeries going, even though we still have thousands of people that are waiting for those surgeries for hip and knee replacements, which are painful for people, prevent some people from being able to work, cataract surgeries and so on. People have been waiting long enough, and so as government, we have a responsibility to protect the health and well-being of all Ontarians. And so that's why this decision is the right decision for Ontario right now.
Minister, where is the Premier's claim of tens of thousands of healthcare workers coming from? Not just 10,000, but tens, plural, tens of thousands of healthcare workers would be out of their job. Where's that number coming from?
Well, that was a number that was based on the Premier's understanding of the situation before the letter was sent out. We know that there would be some significant job losses if we were to proceed with mandatory vaccination right now, but we still support the decisions of individual hospitals to do as they see best. And I would really point to some of the pediatric hospitals for that because they are dealing with very vulnerable patients that don't have the opportunity yet to be vaccinated, although we hope that we will receive approval from Health Canada very shortly for that.
So if the tens of thousands, that's the phrase, if the tens of thousands is coming from the time before the letter to hospitals asking for information went out, is that not now obsolete information? Why has it been repeated today? Do you believe it's going to be tens of thousands?
I know that it could be very significant, and that is why we want to be able to maintain our health human resources so that we can care for the people with COVID, of course, but also care for all of the other people who've been waiting for surgeries. And we've got thousands of surgeries that are waiting, not to mention diagnostic procedures. And we know that what we're seeing in our hospitals right now are patients that are more acutely ill, because to some extent we've had to postpone some of those diagnostic procedures. We want to be able to keep those going so that we'll be able to treat people in an earlier stage of an illness so that they can become well.
You've heard from hospital CEOs who told you, don't do this, I'll run out of staff, I'll have significant staff problems?
Yes, we have.
Even though the Hospital Association, the letter that we've seen, says the vast majority of hospital CEOs, I think 120 of 140, representing 90-something% of all the staff in the province, said go for it.
Yes, that's correct. The Ontario Hospital was in favor of mandatory vaccination policies, but there were some individual hospitals that did indicate to us that they were very concerned about loss of health human resources. Yes.
Which hospitals? Are they in rural northern areas? Were these letters made public?
No, I'm not able to provide that publicly, but I can tell you that there were hospitals in that situation.
Can you help us understand the disconnect here? On the very same day that you're telling nearly 3 million Ontarians you need to go out and get a third dose of the vaccine, you are telling a significant number of healthcare providers it is okay to not even get one dose of the vaccine. A lot of people would look at that and say, that does not make sense. Can you help me understand why you would say to healthcare workers, you don't even need to get a dose of the vaccine, don't worry about it?
We're certainly not saying that. We have been urging everyone in Ontario, particularly frontline healthcare workers, to please go and get vaccinated. We've said that from the beginning. We will continue to say that. That's the best way to protect individuals, families, and communities. So, but in that situation where there are some who are not being vaccinated, we still have very rigorous testing procedures there for the protection of their patients and the families that come in, that they will need to undergo a rigorous PCR testing to make sure that they are healthy and won't transmit COVID to any of their patients.
What do you say then as the Minister of Health? Because ultimately, whether or not you're encouraging somebody to get the vaccine, you are still giving all of these healthcare workers a provincial pass. So what do you say to a patient who, you're saying to them, hey, your health comes first, but also your health may not come first because an unvaccinated employee can have direct contact with you. What do you say to patients as the health minister about whether or not you're actually putting their health first?
What I would say is that from the beginning, the health and well-being of all Ontarians has been our priority, and it continues to be. And so it's the patients that we are protecting by having the employees tested frequently for COVID, but also for the thousands of patients who have been waiting for well over a year to have procedures done that are painful and debilitating. Hips and knee replacements, cataract surgeries, and other surgeries. We want to make sure that we can move forward with that, because while it's terrible to lose someone from COVID, it's also terrible to lose someone from something that hasn't been diagnosed early enough or hasn't been operated on soon enough. So that is why we're taking the entire population.
A vulnerable senior citizen who might have underlying health concerns, they can still be treated by an unvaccinated healthcare worker. Is that correct?
That's correct, but only a worker who has been tested regularly to make sure that they are safe and that they are healthy. That is a paramount consideration and will continue to be.
Minister, are you going to put out? Are you going to put out any of this data so we can actually see what hospitals or even what regions are even having issues with staffing, or to actually back up some of these claims?
The information that was provided subsequent to the Premier's letter was provided in confidence, and so we're not able to produce it publicly.
We'll go to the phone lines for the last question.
Your last question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, Randy.
Yeah, hi, Minister. I'm wondering what this means for other businesses that have implemented vaccine mandates for their employees, like the TTC, any other industry that has a mandate in place.
Well, it's really up to employers to require vaccination or not. I know that many of the large companies in Ontario have done that, but it's also open to individual hospitals still in Ontario to decide whether they are going to require mandatory vaccinations, and some of them have, and we'll allow that to continue.
Doesn't this send an incredibly mixed message to people that are asked for their vaccine passport, their vaccine proof when they go into a business? Hasn't this just opened up a whole can of worms for businesses that are telling people they can't come in?
Oh, this is based, we're dealing with healthcare in Ontario. As I said before, this is the right decision for right now, but we're going to continue to monitor it. And especially as we go into colder weather with more and more people being indoors, we'll continue to review it to see if it remains the right decision for Ontario. If we're seeing increased uptake, then, and especially in workplaces, in hospitals, then we will need to revisit it. But right now, this is the right decision because it allows us to continue with our responsibility to protect the health and well-being of everyone in the province.
Thanks,
So,
everyone.
thank you.
Thank you. Sorry, that's it. Thank you.